Two folks here today. Lynn Sweet, we are happy to welcome back into the program for the next couple of hours. Lynn, last time you were here, I think it was the Arlen Specter Town Hall, and you got to say hello and goodbye. We'll try and get more out of you today. Jonathan Capehart also with us for the next couple of hours, and we are graced with the presence of Representative Anthony Weiner here today, a strong advocate of the public plan Democrat from here in New York. A quote from you from the Huffington Post, and we'll begin the conversation. But you said, I guess this is yesterday, leaving private insurance companies the job of controlling the cost of health care is like making a pyromaniac the fire chief. What do you mean?
Well, look, the fact of the matter is we're in this bind because of the rapid growth in healthcare costs. That's true of all healthcare. But we're also saying to healthcare companies, take your 15% in overhead, take your 15% in profits, and put it in your pocket. Don't put it for checkups, don't put it for hospitals, don't put it for tax cuts, don't put it for patients. And the problem is that we need some force, some government force that can get us all together as a group and say we're going to negotiate for lower prices. That's really what the public plan is all about.
And totally understood. I guess what confuses me a little bit is why the best way to go about doing that is to create a government-run public health care company, as opposed to some of the other things that get bandied about that would simply make for more competitive markets, period, for health insurers, and then obviously some sort of tax subsidy for those who couldn't afford it.
We don't need to create a government entity. 40% of all Americans get their
No, I get that. I misspoke. But you understand my point, which is why do the health insurance companies have such a grip on the government that the only way to fight them is with a total obliteration of them using a public option, or do we have enough control in our government that we can simply create more competitive markets for health insurance companies?
Well, look, here's the thing. The government doesn't have much control over healthcare industry right now. The healthcare companies in a lot of places, there's only one and sometimes two. We here in New York City have a lot more choices because we're in New York City. So there's not a lot of competition. And I put it to you this way. How much true competition is there when you go to your workplace and your employer says, here's your healthcare company?
There isn't.
You don't get to shop around.
I totally agree, but my guess is, why is the public option the only way to create that choice?
Well, because, I mean...
as opposed to, again...
Like what?
Wyden Bennett.
Okay, allowing healthcare companies to create competition amongst themselves hasn't really worked out particularly well because they're frankly, again, for individual consumers, they have one choice. Everyone has a single payer, whether they call it that or not. Sure. It's their individual insurance company, it's their pocket, or it's Medicare or Medicaid. We need to do... The best example I make of this is Walmart. Walmart is able to offer its customers $4 prescription drugs.
They have collective bargaining.
How did they do it? Well, they go and they say, we have this big buyer pool, we're only going to pay $4.
Sure.
Why don't we do that?
I want us to.
That's the point. That's what we have to do. Rather than turning a bank shot and say, let's do it through an insurance company, let's just do it ourselves. Let's just say Medicare for more people. Put it that way.
How is this playing in the House? How upset are people in the House about any indication of backing away from the public option?
Well, look, I think that a lot of people buy the argument that only by having true competition can you keep down prices. And I don't think anyone believes that the insurance companies are going to take care of this problem on their own. But I'll tell you the real problem that we have, and it's kind of a political one. I know you don't do politics.
No, I do. I've got no choice.
But look, the fact of the matter is, who is the White House negotiating with? Are there any Republicans now that say, okay, if you do A, B, or C, we'll sign on? You know, you've got Chuck Grassley, who's been leading the charge all August, and he's the guy negotiating the bill. Yeah. So I think that...
So how do you fix for that? In other words, how do you elevate the conversation between the president and the Democrats and the Republicans from public option or nothing to public option or public option and something else?
I think it's got to be, the president has to say, here's what I believe clearly, and that is, I believe in a public option. Maybe he doesn't believe what I believe.
He didn't say that. I mean, he point blank said over the weekend.
No, but you're saying what should happen. Yeah. Now, I'd like him to support my single-payer plan. Sure. He doesn't. But he should stick to his guns and say public plan is what I want. If we have to negotiate later on, if 25 or 30 Republicans suddenly appear and say we'll vote for something that's a little bit different, maybe at least then there'd be a rationale for negotiating this. Right now there's not. But more importantly, the American people understand the idea that their insurance company is right now taking a lot of money in their own pocket for profit and overhead.
Yeah.
Why?
No, I totally understand that. I guess going back to our earlier conversation, which is it concerns me that the only way to force a competitive market for health insurance is to create a government health insurance company. Not because I have a point of view on government health insurance, but because it suggests to me that our government is unable to create free and competitive markets without...
Here's the problem. The problem with free and competitive markets is this is not a commodity. Yeah. This is not something you can shop around for, by and large. This is not something...
Although that's not true. You guys do it in Congress. You got all these different options,
Yeah, but I got to tell you something. We're the exception, and we say we do it in Congress. Who's the employer for us in Congress? The taxpayers.
We are, right?
And you're paying an enormous amount amount of money for that. Now, if you really want to offer that to every American, we'd really bankrupt the federal government. So and then the question is, are we really prepared to say, okay, some people, like other commodities, won't be able to get it? The answer is no.
Sure.
We pay for them, whether we pay for it efficiently or inefficiently. They go into hospital emergency rooms. We, taxpayers, wind up paying for it.
Lynn, sweetie, you there?
I'm here.
Go ahead.
I have a question even.
Please.
So, Congressman Weiner, I want to make something a little crisper from what you said that I think is important in this discussion. If I'm hearing you right, you want the Obama White House to negotiate with the Democratic family for whom you can make a deal. You have the votes if there's a deal. You control the House, and he should work within the family and not go overboard in seeking Republican votes that probably aren't there and work out the differences that way. I mean, that's what you're advising the White House now.
That's exactly right, except I won't put it as partisan as Democrat or Republican. I think most swing regular Americans want what the Obama plan is offering, which is competition and more choices for themselves. So I think this notion that somehow swing Democrats or conservatives will lose their seats if they go along with the Obama plan is myth. I think if President Obama sticks to his guns and sticks to the principles he's outlined, I think we're going to gain seats, not lose them. Unfortunately, they're not.
Hey, Congressman, so to follow on the flip side of Lynn's question, focusing on the House where the Democrats have a huge majority and can pass anything at once, but then you go over to the Senate where there's a lot of unease among Senate Democrats about some of these plans. So how do you reconcile the two? Is it possible that you could vote health care reform down if the conference bill doesn't have a public option or anything that comes close to that?
Well, I have to tell you right now, there's no votes for the Obama plan. There's no votes for the co-op plan. There's no votes for my plan. Right now, no one has 218 votes, which is why presidential leadership, Jonathan, is so important right now. And it's so important that he sticks to his guns. Now, I believe simplicity helps. I believe that my plan of having Medicare for all Americans is a simple plan that everyone understands, and it's based on a foundation people basically support.
What are the cost implications of that? I mean, I feel like the president ran into trouble when he came out and basically said, listen, we'll bend the curve. And then the Congressional Budget Office came out and said, not by our math, you won't bend the curve. And the president's sort of, and in general, the ruling parties love to go to the CBO and say, look, it works. But then when it doesn't work, you're like, they're not always right.
Something that the American people need to understand is that when you talk about the expense of the bill, it ignores the fact we in New York pay $3 billion for additional taxes for the uninsured. We're not going to pay that anymore.
Right.
We pay more for products and services.
The CBO doesn't account for the discounting of the...
Look, there's no doubt about it that you are going to, what we hopefully can do is take the existing amount of money that we pay, pay it more efficiently, like don't pay the uninsured by just letting them walk into hospital emergency rooms, but give them some insurance, and we all wind up paying less in the long run. If it doesn't do that, Dylan, it's a waste. Well, what have we really done here?
Understood. A pleasure to have the conversation. Thank you for having it with Jonathan, Lynn, and myself.
Thanks for having me.
Enjoy your day.